Good morning, Uganda. It's time for the agenda this Tuesday morning. And this morning, we're looking at the new terms and conditions for the renewal of licenses for nurses and midwives. Welcome to the show. In case you're just joining us, it is Good Morning Uganda on UBC TV. We come to you live from the Nile Avenue. My name is Julie F. Nantaba with Robert Chirabo Nyonyintono, and over the phone is Justus Cherop Chiplangat, the President, Uganda Nurses and Midwives Union, to have this conversation with us. Be part of the conversation, 0709-602592. Send a WhatsApp message and engage, asking your question and sharing your opinion. Over to you, President of the Uganda Nurses and Midwives Association. Good morning.
Yes, good morning, ladies and gentlemen. My name is Justus Cherop, the President of Uganda Nurses and Midwives Union.
Right. It's a pleasure having you on board this morning.
You are welcome.
All right. Now, in July 2026, the mandatory continuous professional development requirement, that is the CPD for license renewal, will take effect. How has this been welcomed in the fraternity of the nurses and midwives?
Yes, thank you so much, viewers and the listeners, and thank you for hosting me. Again, my name is Justus Cherop, the President of Uganda Nurses and Midwives Union. About the question you are asking, the CBDs, this one is a continuous medical education that enables a nurse or a doctor or any other person who is practicing medicine to be hands-on. And the aim is that we want practice as much as possible, and we don't want to forget our daily routine and our procedures that we do every day. This one now, the government or under the Ministry of Health has put in place that in this case, we want everybody hands-on, because sometimes people get overwhelmed with the other duties after work, and of course they have limited time to attend to cases, to attend to patients, and to attend to new cases which come on board. So if we want a good reputation of the nurses and midwives or a medical personnel, is when we are hands-on and we continue getting education. For example, I presume that if you are near a computer and you are ever on computer, you keep on learning several things on your computer. So in this case, the medics tend to forget sometimes because of overwhelm of work. So we say that continuous medical education is very important, that if you are on leave, at least you must do some hours in a practice. You do it online, you do it a workshop, you attend seminars, you attend Zoom meetings, and those you accumulate your points. And of course, if you accumulate your points up to 50, you are good to go to renew your certificate. And if you just remain without those continuous medical education assessments, you will be regarded as a person who has not been hands-on practice. Even if you have been on the ward and you don't attend to new cases, attend to new workshops, it will be very difficult for you to be renewed certificate and license, so that we go at back. We move at the same time. Thank you.
Now, Chiplangat, when you talk about, you said they are called 50 points. There's a term you use in your profession. Now, when you talk about these points, give us an in-depth way through which a nurse, a midwife can gather them. When you talk about attending conferences, do I present evidence that this is what attendance list? What does one go with to prove that really they did attend these, and these are also recognized, or I did attend to these new cases?
Okay. In circumstances, to prove that you have attended, because some people can vote even, but of course, there is a score that we have put that some hours, depending on the hours you have attended a meeting. For example, I have attended a meeting with you online. So we are attending maybe 10 to 15 minutes. I may score like 2 points. They have calculated by Nurses Council that if somebody stays online or in a meeting of continuous medical education for a period of 1 hour, there is a mark they give. And now the proof is we used to have books which they sign by the facilitator. They sign that Mr. Jerob has attended the meeting, a workshop up to 4 hours or up to 3 hours. But now since the world is digital, you lock in a meeting, and of course the running of minutes or hours will be proved by the meeting attended. And if it is not, if it is in the rural areas, they still have those books. We still have those books that somebody can sign and say there was a workshop in Kapchoro Hospital that attended by Mr. Jerob, and this is the number of hours, and you sign that book. So when you are renewing, you recall all, you put all on those accumulated workshops, and the Nurses Council scores the points that this hour could take how many points. If you are 8 hours, they take it, they calculate it according to theirs. For example, I am traveling to WHO, World Health Assembly, and if I attend all those workshops, about 8 of them, before I come back, I would have accumulated my points every day, every hour, and then the attendance is there. I bring the proof that I was there. And also there is online. You can attend online, and there is a proof that you attended, you logged in, and you attended online.
All right, Chiplangat, thank you so much. Just allow us to remind our viewer that we are looking into the new terms and conditions of nurses and midwives, and we're having this conversation with Justice Cherop Chiplangat, who is the president of the Ugandan Nurses and Midwives Union, speaking to us and with us over the phone. But be part of the conversation, all right? 0709602592. Ask your question, share your opinion. Now over to you, Chiplangat. What are the new terms and conditions that nurses and midwives must fulfill before they attain that license?
Ladies and gentlemen, it should not be like it is not terms and conditions that they force people to do it. Of course, where it applies that it is a force, it is part of education. It is part of our innovative education, because it has been there, but it has not been put into practice. And the realization here is that there are people who adamantly don't want to attend workshops and to attend the meetings and to attend any of them. So that's why the Nurses Council say no. We want everybody to be on board, and we want everybody to know what is current. For example, Ebola has just come in, and we are hearing about Ebola and the borders of Congo. And now we call workshops within Western Uganda, and you don't attend. How will you help the community? How will you help the new strain? You don't know any new disease coming in the country. So we say that instead of people dodging that I can't go for this workshop, you must go, and because you are going to practice. And why we renew the license? We renew it because we want to update ourselves or at the current situation, because we want to know the current situation. I can have my license for 3 years, renew, but I can go back again and renew. But before I renew it, I should be or know how do I use this certificate. Because some people are using this certificate to open up a drug shop, using certificate to do any other thing which is health related. So we want that certificate that if you are going to renew it, if you have not renewed it, then it is invalid. But before you renew it, you must attend some workshops in between. And it should not be seen as a punishment. It is not a punishment at all. But we are putting it as a main thing that you must attain this training, because a training is just something to keep you learning every day and every now and then.
Now, Chiplangat, won't this drain health facilities? Because most of the time still we've been having challenges where you hear the nurses, the midwife, they're in a workshop in Kampala, they're in a workshop in Kampala. Much as this had not been implemented or enforced, now that someone knows this is beneficial to them, aren't we going to see health facilities empty? One rushing from seminar to another, workshop to a workshop, in the name of ensuring they gather the 50 points that are required.
Mr. Girabu, that is not true. If we say continuous medical education, every health center and hospitals, district hospitals, even health center 3, we in the morning we do what we call breathing, and we do what we call handovers, and we do what we call CBD, actually continuous professional medical education. That one of the members, if the health center 3 has five nurses or 5 midwives in the hospital, one of them brings a topic, and you share that topic. And that is already, if you attended it, that's already 5 points. Tomorrow you accumulate like 10 points. It doesn't need that you move out of your station. These out of station coming in, this is big workshops that are organized by Ministry of Health. But of course we can't also take all of them. We pick like 2 from a facility, they attend. Another workshop comes in, we say, you, Girabu and Jerop, you went the other time, you accumulated your points, so and so again, Sylvia has to go, James has to go. And it doesn't mean that you must move out of your station. You can have these CBDs accumulated points within the facility.
Okay, thank you for that clarification to the people in this fraternity. You don't have to move. You can have these points within your station.
Indeed. And therein, allow me ask Mr. Cheplangat, what concerns are nurses and midwives so far raising about the new licensing conditions? Therein is a comment or question coming in from a viewer that reads, hello, in most cases we attend these meetings online, but now how does someone know he has attained the CPD points, and is there any proof to be given? Over to you.
Okay, thank you. But online meetings are registered. They are registered and recorded. And in most cases, you log in. And you log in your name, you log in your phone number or in your email. And the proof is that there is a link in the Nurses Council that you also forward that accumulated point. You just send the link, the type of workshop you have attended, and it is already recorded. The moment you clock in, it records the hours you have attended the meeting. Just as, for example, that we are in the meeting right now, me and you are at the studios. I am out of the studio, but it is recording that the Rob and the Lillian or Girabu are in the meeting. and the system will count and count and count. And if you forward that system to the Nurses Council, by the time you reach Nurses Council, the dashboard is there. They just say you what's your name, and you put your name there. It is already registered and it is accumulated. And they will tell you you have got 45 points. You will still need only 2 points or 5 points. And there you go for a workshop, another workshop or another online. You learn something and you accumulate your points. It is a very simple thing, and you can do it in your facility at any time you have a meeting with the other staff.
All right, let's look at more comments coming through from our viewer. Good morning, presenters. Thank you for the morning show. I'm Peter, a nurse from Luero District. May I know from our nurses president about the online points, and how will I know that I have accumulated those points upon attending every presentation or CME? I think that has been answered, but you can elaborate more and land the plain farmer. That is to you, Mr. Chiplangat. But also, how can one nurse know the number of online points he or she has accumulated? It looks like it's rather the common question being asked on there. Anything you could add or clarify?
Yes, yeah, that is very good. And I advise them, the gentleman or the lady, that Nurses Council is now a .com world, and if you go to their website, you will get all those links that you will be even checking your points in the link. So if you download the app in Nurses Council, you will definitely know that I have accumulated these points, a number of points which I have done it today or tomorrow, and then you now see your balance. Even before you reach the Nurses Council now to renew your license, you would have known already the points you have accumulated. That's why we advise people that now we are going to .world, and this .world that you just click Nurses Council and you go to the area of CBDs and you log in your name, definitely will come. Even the license is online. These days you just download everything online and you send it online. And then you will see which duration are you supposed to pick your license. They will even give you an online license, and then you can use the online license to continue practicing, and you will come at any time to pick the hard copy, so long as you have logged in and you have put everything. So everything is online. If you go website of Uganda Nurses and Midwives Council, you will get it, and you go to CBDs, points, you will get everything there. Licensing also, you will get everything there.
Now, Chiplangat, what are the likely challenges to be faced in this new arrangement?
Of course, we are still in a third world country. Data is mostly the challenge. Data, people may not afford every now and then data and to attend online meetings. So data is a challenge. The other challenge is knowing the computer. There are people who were born in the era of .world, the computer, before the computers. So those people are still also having issues. You look at the example of even declaring a wealth in the IGG request you to declare your wealth as a worker or as a government civil servant. And they said, okay, you do it online. Sometimes it is challenging because there are questions and there are areas you may not know to click and to upload and to do everything. So the challenge is still also the technology. So we need to still go with our people on the technology issue. And then another challenge, number 3, is time. People need to create time for this because they may assume they are, okay, no, the assumption the nurses are busy generally, but the nurses have offs every week they get 2 offs. So those 2 offs you can utilize for this instead of you give 1 hour and attend to yourself for your accumulated points. And then you go your garden, you do other things, you graze your animals, the rest of the hours. But set 1 hour or 2 hours for professional development of nursing profession. So those are 4 main challenges that I'm seeing that our nurses have.
All right. Thank you very much, President Chiplangat. And more of the questions coming through. Hello, thank you for the show. How can one who is not formally employed get these points? This is Richard from Nebi.
Yes. Richard, so long as you are a nurse, it doesn't mean that you should be employed to get CBD. No. Because even if you are working in a pharmacy, you must learn something in everyday life. You must also Google online and be online over some medical training messages. So it doesn't mean that it's only for civil servants. It is for every nurse who has qualified and he has got a certificate of registration at the Nurses Council. The moment you start getting that certificate, either enroll certificate, diploma, and you are not practicing anyway, still we need those CBDs to continue. You have to attend. You go even volunteer to go to hospital. You go and listen to what they present in the hospital. You can access this everywhere, online, or you go to the nearest ALS facility, you just attend a meeting, you say, I'm a volunteer nurse, I'm here, I'm just to listen. Then you accumulate your points.
Right. Good morning to you. Most of the facilities are understaffed and the medical workers are forced to work at any time as long as the patient comes to the facility. Someone can log in online meetings while attending on the patient. Is it really effective? This is Simon.
No. That one has not practiced nursing properly because you cannot have 2 masters at the go. If a patient has come, stop what you are doing. If you have done it like 30 minutes, stop it. You stop and then attend the patient. When the patient is attended to, he has gone home happily or he is admitted, then you resume your appointment. You resume your hour to continue. So you cannot do masters as they go. Then the other thing which I wanted to educate the nurses in this country is that when the patient arrives, the discussion of that patient is another medical education. You discuss the patient jointly, maybe 3 people or 4 people, more especially health center 4 where the doctor is, health center 3 where the clinical officers are. You discuss that patient, you discuss the condition, how it has come, maybe as a lot of anxiety, a lot of what you discuss that patient as a joint team. By the time the patient is triaged and taken it to another area or referred, you have discussed, and that's also learning. That's also a learning session that you have discussed this patient for 3 hours, you have discussed this patient for 2 hours, and you have got something. And now by the time you reach and say, we are referring this patient to psychiatric department, then you would have known that the patient is medically sick, but is sick of psychiatric condition. Not malaria, not typhoid, not HIV, but it is psychological problem. So when you are doing all that as a team, it is already a learning process in that manner. So whoever is in the health facilities, they will learn that because they normally discuss the patient before they refer them.
All right. Good morning, moderator. Thank you for the show. To the president, there are thousands of nurses and midwives who are self-employed, in other words, drug shops, and only depend on online meetings to accumulate the points. But whenever we attend, We are told that portals haven't been activated. Kindly confirm this and please let me know how I can check my points. This is Joy P.
Yes, as I said before, that the Uganda Nurses and Midwives Council has already implemented the .com world. Everything in the Nurses Council is in dashboard of internet. So if that person can log in, if he gets difficulties, he can call my number and then we help him. My number will be 0777 000 997. I repeat, 0777 000 997. So you just enter in the dashboard and you go to CBDs, you go to licensure, you go to registration, you go everywhere and then you get what you want. Otherwise, Nurses Council is already in a flexible manner that you can do things out of Obi, out of Kampala.
All right. And more questions coming in for you. Good morning. Otukol Tom from Nakapiripirit. Why is it that the regional officers for nurses and midwives council are not empowered to sign or deliver signed licenses to our reach other than going up to Kampala? This here is a concern all the way from Nakapiripirit.
Yes, the council had already put in place regional offices for licensing. But now, when we try to upgrade I am actually talking on behalf of the Nurses Council because they know what they are doing and I have been practicing as a nurse. And I'm still practicing as a nurse. That question would be directed to the registrar. But for me, what I know to the best of my knowledge is that when those offices are still available in regional referral hospital, but when they were upgrading the system to total world, because that one was you go there, you register, and they verify your documents, and they physically and they issue you the license. But this time now we are saying that gentleman can do it in Nakapiripirit. He can sit in a cafe in Nakapiripirit or using his smartphone, and do it in Nakapiripirit. So the work of regional offices is lesser now. We don't need it more that because everything is now registration is done online. Everything is done online. So to reduce paperwork and to reduce human resource capital is when we say even somebody in Nakapiripirit in Gitepo National Park, he can do it and get his license registered.
All right. Well, a lot of questions are coming in right now. But as we begin to close this conversation, allow me sift through all of them so that you're able to speak into them, as quite a number of them also carry the same ask. Hello, thank you for the program. This is Nyonyi Ntono Dokas, following from Iganga District. I'd like to know what the renewal of licenses verifies in terms of salary payment.
No, we don't renew the license in terms of salary scales or what. No. The longer we categorize as enrolled as study certificate, a diploma, that is somebody who has done diploma post certificate, then there is degree, there is master's, and there is PhD. Now, we categorize in academia. We don't categorize in a scale. You may be having a PhD in Uganda, and you have not been getting that scale, but you have a PhD and you have to register your PhD now. So you may be earning a enrolled salary and you have gone through all education and you have a PhD. So you are new or you are licensed to do license according to the academic qualification. We don't look at the scale, because if we look at the scale, then we shall be waiting for people to be employed. And now, what about those who are doing private practice? So we don't use the scale to renew certificates. We use academic qualification to renew the certificate. The renewal of PhD is different. A renewal of master's is different. A renewal of a diploma is different. A degree is different, and certificate is different.
Now, Justice, as the Uganda Nurses and Midwives Union, what are you doing as far as popularizing this so that your members do not end up being affected?
Exactly. Now, we actually, from next week, we are moving out throughout the country. We are beginning with the Karamoja, and then we come to Teso, we go to Sabei and the Bugisu as we come back to Central and go to Western Nile, everywhere in the country. We wanted to get these nurses and tell them exactly what we have been discussing now, because most of them right now, others are sleeping because they are night duties, others are off duty, they are not listening what we are discussing. So what we have come up with is to move outside the country, and educate our nurses. So we are beginning on 20th of this month to move up country, throughout the country, and we educate them, we give them this information.
All right. How different are the renewal requirements from the previous ones for this time?
Yeah, of course, the previous one, you have to travel from Isingiro, Kisoro, or Ajumani to Kampala. That is money. Money and time. So that's coming from Ajumani, has to travel 2 days. The third day has to go back. And again, the lineup, the congestion is at the ministry, at the Nurses Council. You remember there was a very big congestion at the council some 3 years ago. And the children would collapse. The mothers come with the children. Those are pregnant mothers also lining up. They were fainting every now and then because the queue. The principle is first come, first serve. So now, all over the country, you remember we are over 70,000 nurses in this country. And most of them need new certification, and others need renewal. So eventually, most of them, like even 10,000 can do for today. So you find that it is very difficult that the 5,000 to 10,000 comes today to renew. By the time we finish the 70,000, it would have brought a lot of chaos and problems. So we opted and say no. We are to go in another way. That's why we started prioritizing the regionals. That if you are from Western Uganda, you go to Mbarara and you go to Kabani. That one used to be. And now, things again, that one also became another difficulty also. We now applied the online. So we said, you sit anywhere and you do it. So it has reduced the congestion, it has reduced the time, and it reduced economically. Nurses are not spending a lot of money because you can pay your money even from there, and then you just upload the receipt. And that's all. Other than bringing money to the Nurses Council, they tell you to go to a bank, you bring the receipt, all that time is wasted. So this time is very simple. You can do it within 1 hour, you are done.
All right, getting into more of the questions from many nurses who are following the show, and midwives at that. Good morning, and to the presenters and the nurses president. Why is it that online license renewal takes so long to be approved for payment? Because I have waited for long and I can't proceed to payment. But also someone else comes through, Abraham Muhindo, who says, why are they bringing more unnecessary regulations? instead of advocating for better nurses' welfare and recruitment of more nurses and midwives who are already rotting on the streets jobless? This is Abraham Mohindo who asks that tough question. Over to you.
That question is not tough. We are trying, we are saying Uganda Nurses and Midwives Council. Its role is to regulate the nurses of this country and midwives, to make sure that we are safe, we are practicing very well. The review, as I told you, is purposely for updating the status of your certificate. You can be like a senior 4 labor. That one is different. But this one, you have to update yourself and say, I am handling a human being. So my knowledge, my new trend of learning is updated. Secondly, we are not bringing complicated things. These are done all over the world. Even when you go to practice in Rwanda right now, it is supposed to be, you must accumulate also points. If you go to Tanzania, the same. You go to London, the same. For them, those ones, they are even more strict than us here. So, if a nurse is going to be exported right now to go to Switzerland, he must accumulate the points as we do. It is the International Council of Nurses who issued this issue. It is International Council of Nurses, meaning that all the nurses in the whole world must undergo these TPDs. And even the medical doctors, they have the same. They must also go under CPDs. Why? There are only two reasons. A reason of going to medicine professional education is just to update yourself. You see that recently when we had COVID. Nobody knew that this is COVID. Nobody knew. After people dying, then we realized that there is a disease called COVID. Now, who knew that? Till we were born, we did not think. But it has come. But it has come in a recent generation. So if we just go back that we were trained in the early 80s, there is nothing which we can learn. No. HIV came recently, we did not know. So if we continue updating ourselves, we shall know the current situation, we shall know the current disease, we shall know the medication, how to care them. Then the welfare of nurses. We have advocated the welfare of nurses right now, and that is my topic. And we got the increment of salary 5 years ago, and this year we are advocating for 40% increment because we agreed with the Ministry of Public Service and Ministry of Health that the salaries should have they should be giving us in first manner. A first manner means that this group should be elevated first, another group elevated later. So meaning that Nurses Union was elevated first ago. For nurses, salaries of doctors, scientists, all of us 5 years ago. Then you remember that the other year it was for legal team, the magistrates, the judges, they also got there. Then the other year was also for teachers. So we are going slowly by slowly. So for now, we are advocating now that this financial year, nurses should be considered for a remuneration because 5 years is long down the road and everything has changed and the economy is going up. So nurses are supposed to be given some token this financial year. So we don't just rush that we need money, but we need also value of money. So now if things we have worked for 5 years, we can now see that we need value of money. We need some more money. Thank you.
All right, thank you very much. Justus Cherop Chiplangat been speaking with us, and he is the president of the Uganda Nurses and Midwives Association. We've been looking at the new terms and conditions for the renewal of licenses. Now it's an avalanche of questions coming through for you, Mr. President. But the number for you, dear viewer, to call and engage is 0777 000 997. That is 0777 000 997. Call the president of the Ugandan Nurses and Midwives Association so that you are able to talk more and understand the issue at hand better. What are your parting shots?
Okay. I want to thank nurses for the work well done this year. Nurses, thank you so much, and midwives, and thank you for attending midwifery day in Moroto. It was very colorful, and thank you for caring the patients. And everywhere you are, we are proud of you as a nurse, as a midwife. Whether you are in a private practice or civil servant, you remain a nurse. It is our profession. Keep the light burning as Nightingale. We normally use the torch or the light, the candle, to show that the bride of a nurse is here. So please keep the candle lighting and move forward and care for the patient. Secondly, I want to remind nurses union that the International Nurses Day is going to be celebrated in Kololo on 20th of June next month. And the guest of honor is likely to be the President of the Republic of Uganda. However, we want to caution you about Ebola. Ebola is around us here, and we need Ministry of Health to guide us, and we shall communicate, because now if Ebola is around us, then we may consider the serious precaution of how we handle, because International Nurses Day, people come from very far abroad, they come to join us in celebration. So we may consider it postponed, or we may consider going on, but with precaution. So I therefore ask you, all the nurses in this country and midwives, that be ready for any communication. We are waiting for Ministry of Health to communicate to us this week to tell us that there is a way forward for International Nurses Day. And you know, as the president of this country coming to officiate, he will be cautious of people not to spread or to catch up with the Ebola. So we don't want to catch up with that. So we just wait for the time to come. We shall re-announce. I will come to the studio and announce that the dates are still on. But we are still on until the ministry pronounces itself about the International Nurses Day. The conference begins on arrival on 17th of June, July, of June. Then on 18th, we shall be having a conference, 19th conference. Then on 20th, we shall be marching in Kololo grounds, ceremonial grounds, if the Ebola would allow us to do that. But the guest of honor remains the President of the Republic of Uganda, His Excellency Yoweri Kaguta Museveni, who will be the guest of honor. I thank everybody, and I thank you for hosting me, and thank you so much. Next week, I will be again in the studios. Be alert and be aware of what is going on as nurses and midwives in this country. For God and my country, to love and serve.
Indeed. Thank you very much, President Justus Cherop Chiplangat, President of the Ugandan Nurses and Midwives Union, for speaking with us this morning regarding new terms and conditions for the renewal of licenses for nurses and midwives. What's putting a smile on your face, Robert?
Well, he's confident. His way of saying we wait for what next. Either we shall have that day or we won't have that day. I'll have to communicate. So
right.
Ebola has changed things.
I know, right? I know, right? But the conversation comes to a close. For you whose question has not been answered, a lot of questions. Time is an enemy, very limited at that. But do call the president on 0777 000 997. That is 0777 000 997. Call him and you'll be able to get the answers that you need. And of course, for Robert and myself, that is representing all Arsenal fans who are keeping fingers crossed that the EPL championship is won. For now, good morning for God and my country.
Live from UBC Studios in Kampala, this is Good Morning Uganda.
Exercise can't be sustained. Eating can't be stopped. It's even harder to lose weight. Come and give it a try. Ginshikang L-carnitine chromium capsules. Plant extract, scientific ratio. Take 3 capsules each time. The active ingredient accelerates fat burning, eat twice a day, don't take a detour. Weight loss starts now. Ginshikang L-carnitine with chromium capsules helps you stay in shape. Please follow medical advice when taking this product.
Live from UBC Studios in Kampala, this is Good Morning Uganda.